Well, hello and welcome to the latest episode of the Ultimate Wellness Group Transformation Tuesday. As always, I appreciate you taking some of your time out of your schedule because there's so many things that you could be doing, but you decided to spend some time with us here at the Ultimate Wellness Group. So today is going to be a wonderful show. We're going to have a continuation of our first 2 months of this year being our mental health months. And as you can see, the two books are up there are the books that we are currently reading in the Ultimate Wellness Group Transformation Tuesday Book Club. Of course, this show is based, and the foundation of this show is How to Eat to Live by the Honorable Elijah Muhammad. And in addition to that, in January and February, we're reading The Unapologetic Black Guide to Mental Health. It has been a powerful read. I would suggest, whether you are in the book club or not, this is a book that I believe all Black, Brown, and Indigenous people should read, but specifically to Black people. Today's conversation is going to be about some of those topics that we typically don't like to talk about, or we typically shy away from, or the subjects are covered once people get angry and start to holler and scream and then potentially regret what they say, right? And so I pray that we are growing, and I pray that we are learning how to take these difficult subjects and think our way through and see how we're going to produce a different reality in the next generation and generations, because that is the purpose. One of the ideas, of course, originating with these 2 months being mental health, was to begin the year having conversations about some of the things that we typically don't like to talk about, because it's been a pretty tough mental health year, 2020 going into 21, right? So let's go ahead and get started. In the name of Allah, the Beneficent, the Merciful, I bear witness there is no God but Allah, and I bear witness that Muhammad is his messenger. I further bear witness that God came in the person of Master Father Muhammad, taught that great man, the Honorable Elijah Muhammad, who has a tree of disciples that is amazing. But again, the foundation of this show is How to Eat to Live. And of course, neither of them left us alone in a time of trouble that we currently live in. We have a guide, the Honorable Minister Louis Farrakhan, and in their names I greet you in the words of peace of Assalamu alaikum. And if this is your first time listening in and you are not used to hearing those words, it just means that I am asking God to cover me and guide my words, guide my thoughts, and guide my spirit as we do this program. And then in addition, it is about wishing you peace in a time of trouble like we are in. The words Assalamu alaikum means I pray for peace for you. And so I start the show in that way, so that I prayerfully that God's spirit will be through me, and that my ego and my arrogance will be removed for your benefit. And so today we have a special guest, and we are going to be discussing some of those taboo conversations. And so I pray that you all are ready to enjoy the conversation, listen, and have your comments, right? And then also think about, as we are having this discussion, what you are doing for your mental health. And I want to be clear before we get directly in the show, just to make sure that we are all on the same page, because for the rest of the month, I think we're going to have some powerful shows. Today is, of course, the taboo conversation. Next week will be healing from the loss of a child. The week after that will be another conversation about what to do about your mental health and how is it associated with your physical health. And then if God says the same, got a real powerful show. The last day of the month, the last Tuesday of the month, we'll be dealing with sexual molestation, something that's going to be probably one of the more difficult shows I've ever done, but I think it's going to be worthwhile to have the conversation because it's happening in our communities. And, you know, I remember growing up as a young boy, on many of occasions, I heard my mother and my father say things like, this stays in this house. This conversation doesn't happen outside of this house to nobody. And to me, that's destructive, because, you know, there probably are some things that, you know, should stay in families, but there are some things where we have to start being bold and courageous enough to talk about some of the things that are happening in our homes, that if we shared it with other people, it might save other people's lives. It might strengthen somebody else to not have to go through something devastating. And so I think it's going to be a very interesting month for the Ultimate Wellness Group, y'all. So please tell a few friends, share the show, please. And I also want to clear up, I still am having you know, issues with a lot of things in my social media, but the Ultimate Wellness Group is not on Facebook. It doesn't work on Facebook anymore. So if you tell anybody about this program, it's the THEE Ultimate Wellness Group for Facebook, and it is the Ultimate Wellness Group on YouTube. So, you know, share the show, tell somebody about it. I think this is a type of conversation that we really have to have in the Black community, the brown community, and in our indigenous communities, because until we start having these conversations, we're going to continue seeing this cycle, right, of mental health issues that are not dealt with. And mental health issues doesn't necessarily mean the person on the corner talking crazy, living on the streets. That's not the only mental health, right? We all have mental health issues. How do we deal with stress? How do we deal with loss of a job? How do we deal with loss of a parent, a sibling, a child? How do we deal with the difficulty factor of 2020 and not being able to socially interact with people that you love? Those are mental health issues. How do we apply whatever it is, the tools that we have to deal with those type of situations? And so we're going to start. We have been discussing that since January, and we're going to continue that through February with some very powerful shows. So I'm going to have to get up and touch this computer. So I'll be right back, and we're going to start the show. Okay. Ready, my sister?
I'm ready.
Okay, well, everybody, you can see my sister's now here, Dr. Monique Swift.
Yes,
I'm about to mess up and say your name wrong.
okay.
Monique Swift. We are going to have the Taboo conversation this evening. So, sister, go ahead and introduce yourself, please.
Yes, sir. Well, assalamu alaikum, because I wish peace for you too.
Wa alaikum salam. Thank you.
Yes. So, and greetings to your audience. Thank you for having me. My name is Sister Monique Swift, and I hate introducing myself, to be honest, but here we go. Member of the Nation of Islam, first and foremost, right? About 30-year member. By profession, I'm a psychologist. I have a small private practice in New Jersey. And I am also do more of my work is consulting work, work with companies, helping them. Most of it is around being, trauma, being trauma informed. I specialize in the area of trauma, help organizations, companies to become more trauma informed. And also, sorry, you threw me off there, helping.
Sorry about that.
Yeah, that's okay. What else do I do? Trauma specialist, but I'm also currently sitting as the president of the New Jersey chapter of the Association of Black Psychologists. So that takes up a lot of my energy and time, but I'm so very honored and humbled to be in that seat of service to such distinguished, conscientious professionals. And so I guess I'll leave it there.
Yes, well, you and I have had a couple of conversations since the greatest love story ever told, right? And I thought it was a beautiful way to start the year with, having a conversation about, of course, some things that we typically don't have conversations about. And your specialty is, of course, in that area of the difficulty factors, right? And so the first thing that I would like for you to address, please, is the power of words. In your experience and the things that you've seen and the way that you have helped people progress and come into a better place, what would you say is the power of words? And for more than one reason, right? For some of us and the things that we heard as we were coming up, but also some of the things that we use, some of the statements that we make, and some of the words that we kind of use, like the word can't, or, other words like that. Can you speak to that, please?
Yeah. So this is interesting you asked that question, because I've been in the last couple of days, even like really studying and trying to understand vibration and frequency. And so when you pose that question, the immediate thought that came to mind is that, yeah, words there's a frequency, there's a vibration to words. And so there's a very powerful vibration to words. But then what comes to mind also is something that the Honorable Minister Louis Farrakhan said, which was, he explained that matter of fact, I think you referenced this in that show, the love story show, that the blood takes approximately 7 minutes to make a complete circuit from the head to the foot to the head. I think you said that also there.
Yes.
And so what the minister was explaining was that if you visit someone and they're ill, they're not well, if you assert a positive word, that word within 7 minutes, you will see a change in the person that you have visited. Because when you give a positive word, there's a vibration with that word, and that vibration is carried through the body in the blood. So that's also what comes to mind when I think about the power of words. They can actually have a physical impact. It's more than just a cognitive or emotional thing. It can actually have a physical impact on our bodies. Because, of course, I think one of the shows that you said is coming up, there's a connection. You really cannot extricate the psychological or the emotional from the physical. It's all one. But in this world, we try to kind of act like they're different. But also, I'd say, too, that in our own life experiences, we apply meaning to words. And I see this a lot in the area of trauma, where that, if I have experienced something that's pretty severely threatening, life-threatening to me, if there are certain words that I associate with that experience, when I hear those words, it brings me back. It triggers that trauma again. So there's also the associations that we personally make with words that carry power as well.
Yes, ma'am. Powerful response. Thank you. I'm going to give a couple shout outs and we're going to get right back into it. Okay.
Yeah.
8 Electronics, walaikum salam. And thank you, brother, for the shout out for the book club. And Lynn Ali, walaikum salam to you as well. Let me see what's on Facebook. Tracy Beasley, Aaliyah Muhammad, Priscilla B. Timmons, Storu Tassant Fulton, and Khalila Muhammad. Walaikum salam, and thank you for all of you coming into the show. So next, I know you listened to that greatest love story ever, and one of the things that was really on my mind from that show was the state of mind that my friend's son has had to have been, and maybe will still be dealing with, and that is that he was driving the car that his good friend and of course the people that were there, his father, his uncle, and the other aunties and mother. What kind of things have you dealt with similar to that, and how would you help coach a person through a situation like that where they were involved and probably take some of the guilt? And then as you heard, especially from my friend Streeter, he talked about everybody having that guilt factor, like if I woulda, coulda, shoulda, you know what I mean? And so how would you kind of assess that, and what would be your way of helping people fight and work and process their way through that type of that feeling after a death?
Yeah. So I think one of the first, we just talked about what kind of words having power, and I'm a proponent of naming things, because sometimes we have these experiences in life and we feel alone with those experiences. We feel like nobody understands it. We feel like, okay, like this is only me. But then you encounter the fact that, oh, it's a thing. Like there's a name for this. Then suddenly you are able to kind of disintegrate yourself from that particular phenomenon and look at it as a third person versus this phenomenon is me. So I say that to say, when I saw that with the son, I was just empathizing with how much I'm going to call survival guilt, right? There's survivor guilt. I imagine, I didn't hear that really being spoken about, I don't recall, but that's something that's pretty common. Like he's driving the car, this was this fatality that occurred, and so it's this sense of, well, why was it him? Why not me? And it should have been me. I was wrong. That I somehow deserve to be the one, but it's not me. So all of these thoughts kind of spiral in a person's head in a situation like that. And I think I did hear some of that from the dad. That really, really deep sense of guilt for what happened. And so I think naming it, first of all, and helping someone to recognize that this is it's a normal part of the phenomenon of what you're going through, can be really helpful to now kind of take it out and put it on the table. And let's look at this survivor guilt thing. Let's look at it and understand it, because it is not you. And so, so some of the things would be, okay, do some psycho ed around that, right? And helping them to understand that phenomenon. And then also helping them to recognize, I think this is a big piece, that many of the questions that they're posing don't have answers or won't have answers. And it's not about if the questions are they're less about, I want an answer, and more about, I want to change what happened. And a common, I guess, example that I'll give, is like the child who wants to go out and play, and, Mom, can I go out and play? No, you cannot. But why? Because it's raining outside. But I'll put on a coat. No, you can't go out. But why? Right? So that why is not about, I want to know your reasoning. That why is about, I want to change this, and I'm going to keep on nudging at it until I can change it. And we do the same thing psychologically in our minds with situations like that. But why did this happen? Why did I turn the corner? And why didn't I just do this? And why didn't I just do that? And that's really not about, I need the answer. It's really more about, I don't want to accept what is.
Yes, ma'am. Yeah, that's a great point. So just as a short segue, we're still dealing with trauma. But, one of the traumatic things that happens in the Black community that we don't like to talk about, that's taboo a lot of times, is the trauma of sexual abuse. Whether it is, uncle or grandparent to a child, or the other way. I mean, most of the time, I think when we think about molestation and things of that nature, we think about men to women, but there are also things happening to boys from women, and also men or, uncles to boys and things of that nature. And of course, that typically, like I said earlier, is one of those things where people will say things like, that stays in this family, that stays in this house. And, being in our field, the healthcare field, when we deal with these type of things, we know that you can see patterns. If it's a young person that's doing it to somebody younger than them, it's because something happened to that person. They were traumatized. They were bred, or I shouldn't say bred, but they were patterned to not tell, to be afraid, and to not want to cause any problem, and not to bring this thing up in the family. So is that something that you deal with as trauma? And if yes, could you talk a little bit about it in general? And then let's go into how we could maybe influence our community to start having the type of conversations where we start to decrease or stop this type of activity from happening.
So there was a lot of layers in what you're saying.
Yes.
And so, yeah, so sexual abuse definitely is something that I had to deal with. I have dealt with. Sure, we'll deal with again. I can recall Honorable Mr. Farrakhan talking about Mother Khadijah telling him that she was taught in her class not to leave her female children home alone with him, and that initially he had somewhat of a adverse reaction
Yes.
to that. How would you suggest such a thing? But
Right.
when he became a minister, he understood because he began to see how prevalent sexual abuse was.
Yes.
And so I say that to say I similarly have experience in working with clients that it is extraordinarily pervasive. Not everybody who comes in and sits in the seat and that I work with is coming to be seen about an issue of sexual abuse, but I would say a good majority of the women specifically that I work with have some sort of sexual abuse history.
Yes.
And so I would even put it up, 80, 90% of
Right.
the women have some sort of sexual abuse history. So it's an issue. It's a very relevant issue. And it's an issue that is also suppressed a lot with what you talked about with the secrecy, right? This doesn't go anywhere. We don't talk about this, but it even goes any deeper than that. So I would say there's even some degree of benefit that if it's acknowledged inside the house and told not to be carried outside the house. But for the most part, I would say of those 80, 90% of women that I've worked with who have had sexual abuse experience in their history, that a good, maybe even 50% of them, it wasn't like, let's keep this a secret. It was, I don't believe you.
Right.
Which is another trauma on top of the
Wow.
trauma of being sexually abused.
Yes.
So they would go to their mother, usually a mother, and they will, and the mother's like, no, they blame the child. It's your fault. You shouldn't have done that. You shouldn't have been around him. You shouldn't have been dressing like that.
Right. Right.
That never happened. And that's devastating.
Mm.
That's devastating.
That's
I'm
right.
working with someone right now, in fact, who had the same story, but I've seen it time and time again. And so that is, again, you're talking about insult to injury already.
Right. Right.
And so there are layers of trauma that happen in there that don't get healed because there's a very strong message in that. Don't talk about it. So especially it's don't talk about it. So most people don't. They don't carry it outside the house. But if you do disclose it to a parent and you get that type of response, you definitely don't talk about it again because I don't want to get that rejection again. So I'm going to keep it to myself.
Right.
So it gets so it's something that's very insidious. It's insidiously harmful to the person because then now it becomes almost reflexive. So whereas I thought something out there was wrong that happened to me, now it was me. It was my fault. The self-blame begins to set in because I couldn't process it any other way. And especially young children. Young children have a very egocentric way of thinking. So everything happens because of me. So when young children are molested, often the self-blame is where they go. It was my fault. I did something wrong.
Right.
Yeah. I know there were other elements of what you were saying.
Yeah. Well, I think, your points are excellent. I just, I wonder, because of course I had that in my family coming up and, met, like you say, I mean, I've had so many women confide in me in my career, not very many men, but the prevalence of it is so pervasive, and the reality that we don't talk about it shows how pathologic we are. But I'm wondering if conversations like this, like if we have conversations and people get a chance to start discussing it, will that lead to a solution? Because as we know, it's a patterning type thing. This person was done this way and then they wind up doing it to somebody else. And so this secrecy is what stops young people. And I wouldn't say just young people, but those who are vulnerable, it stops them from having the type of tools to see it and to be able to stop it before it happens, or to go and get somebody that they know would protect them. You know what I mean? So what do you think about the aspects that we need to implement in our communities to try to start to turn this around and to have it like I said, either eliminate it or definitely decrease how much it's happening.
Yeah, I think speaking about something, bringing light to it, not keeping it in the dark is a big piece of, of the puzzle, big piece of the part of the solution. Even for a particular client I'm working with now, she was saying I think it was in school where, they have the good touch, bad touch lessons that are going on. It was because of that she began to realize and process, wait a minute, that happened to me, and so that wasn't okay, that was a bad touch. And so having conversations about this and helping people to kind of see what's going on, again, putting a name to it, right? It really does help people to look at it from a distance versus just having this internal experience that they don't understand. So talking about it and talking about it, educating people about it, not being afraid to ask a question. Many of us don't ask. We suspect, we walk around it, we tiptoe around it because we don't want to know. I don't want to know the truth. How many of us within our families may have had some sort of suspicion, some sort of indication, something ain't right, or that person ain't right, and I think such and so and so, but we never really, we shut it down because we don't want to know. Right. So not being afraid to ask that question, doing our own internal work so that we're not afraid to ask the question. There's so many different angles and entry points that we can attack this problem in.
Yes.
But we all have a piece of it. But the worst thing we want to do is kind of keep the secret. That's the worst thing that we want to do.
Yes, and as you say, it's layered in so many ways, because like you say, I mean, there are situations that I've dealt with in my career where a mother will tell a child that didn't happen, you made that up, or turn it against the child. Mm-hmm. But some mothers actually feel so guilty that it happened in their household. You know what I mean? So there's that layer of issue that, as you say, is such a deep situation. I pray that we're starting the conversation. I also pray that if anybody's on the show this evening, first of all, thank you for coming. And please share the show if you think this is a type of conversation that needs to be had and that will start to, inshallah, God willing, start the process where we start to decrease and stop this in our communities. And then again, check out the books, How to Eat to Live and The Unapologetic Black Guide to Mental Health. We're reading those now. I think that for those who are not in the book club and aren't reading it, I think you should get this book or at least put it on your list of books to read. Most powerful mental health book I've ever read, and I've read quite a few. This one is definitely home, and I think this sister is doing a wonderful job of making it directly tied to those of us that have been through certain things. Black people have been through things that make us similar, that make us think similarly, but there is nobody else that addresses it in our way. So that's why it's so powerful. A couple of comments. Roderick Barnes, thank you for coming in. You say, great topic. Words have power, and that power increases exponentially when repeated over and over to the point of irreversibility with some individuals. Yes, sir. That's powerful, bro. Linda Nzinga, thank you for coming in all the way from Arizona. Sister Queen, thank you for coming in. And Sister Queen says, many of the questions asked don't have answers, don't want to accept what it is. She says that's a powerful statement by Dr. Swift. So she's bearing witness to you, my sister. So the next thing that I would like for us to discuss is the trauma of loss, right? And I'm sure that's something that you deal with on a regular basis. But could you kind of touch on the difference in, let's say, a person losing a parent versus a parent losing a child? Can you kind of touch on that and what the difference of those are?
Yeah. And so before I hit on that, I just a couple of other thoughts in regard to the other piece that we were talking about. As you mentioned something and you triggered a thought when you said sometimes mothers feel guilty, and it could be fathers too, but mothers often has been the story that in my anecdotal experience. Yes. But that mothers feel a sense of guilt because it happened in my home. So now I don't want to deal with that. Cognitive dissonance is kind of what we call it, right? Because in order to deal with that, that kind of chips away at a lot of other stuff. So I don't want to deal with all that. So I'm just going to shut this down and deny that this is the case because now I can rest at night. And so, yes, I think that's very true. But I wanted to go one step further. Another thing that I see is that not only does mom feel guilty because, or is responding that way because she feels guilty that it happened in her home, but a lot of times it happened to mom. Mm-hmm. And so to confront, and that's usually one of the questions that I ask, if someone is sitting in my chair and this is part of the history, if they have any knowledge of whether or not that has happened to mom. A lot of times they don't know, but sometimes it very much is the case. But that is true in some cases, that in mom that happened to, mom was rejected and denied. She never dealt with it. Now it's happening to daughter. And if in order to acknowledge what happened to daughter, now that kicks up my stuff. I can't, that's too much. Yes. It's too much to deal with. Right. So I have to shut it down. Right. So we have to look at and understand when we're looking at trauma, often it looks really ugly on the outside. There's so much pain. And if we could somehow get through the ugliness of the trauma to see the pain, now we can have empathy there. And now we can begin to spark healing. Another piece of that as well is with the men or women, right, who are perpetrating these abuses. Majority of the time, they themselves have experienced trauma.
That's right.
And that's a very unpopular statement to
That's
make.
Right.
People don't, and a lot of women don't want to hear empathy expressed toward their perpetrator.
Right, right.
But the fact of the matter is, this person is doing what they're doing because likely it happened to them. Yes. Because likely they've experienced some sort of abuse or trauma and they don't know what to do with themselves. Right. And so I just wanted to put those things out there as well, because I think it's important to look at the different facets of this, because often we look at it as victim perpetrator, but it's not always that clean. Sometimes it's victim and they're hurting each other.
That's right.
But
excellent points.
Yes, sir. And so trauma, you were just talking about trauma and the difference between losing a parent and losing a child. So I would have to, by the grace of Allah, I haven't had either. And I'm thankful for that. But I have to go with what I've seen and what I kind of understand about that type of a loss. I've heard many people who at my age, people are beginning to lose their parents. And so both of my parents are still alive by the grace of Allah, but many people that I'm, connected to, they're beginning to lose their parents. And I've just heard it said time and time again, that losing a mother is a pain unlike none other, right? And then you flip that and you look at or listen to people who have lost a child, and it's just like, it's like losing a limb, right? And so I don't want to speak about better or worse. I can definitely can't even or wouldn't make that comparison. One can't put a quality of pain on either. But I would say that maybe there's some difference in that as a child of a parent who's deceased, who has passed, there is an expectation, right, that I'm growing up, that I'm kind of individuating and I'm moving on, that I'm no longer dependent upon my parent. And so when that parent passes, of course, there's a void there. Of course, there's pain there. But the expectation that would be my forever person is I don't think is as much there. And maybe even some of the audience members can speak more to that. As a child, as a parent of a child, you kind of always, that's my child, they're always going to be there. I'll go one day, but my child, I will always be there for my child. And you expect that your child will be there. And so when a child is taken away, it is such a violation of expectation.
Yes.
If I can say it like that.
Yes.
The expectation is that I go first, you're still here. And when it happens the other way around, it boggles the mind, because that's not how it's supposed to be.
That's
right. And so that's, I think, one of the things that come to mind when I look at potential differences. Is there any anything more that I think that you would want to say to that?
No, I just think that was a powerful statement. It's like a violation of expectations. A lot of times that's a foundation of so much pain. My expectation was that my mother or father wasn't gonna, let something happen to me. My expectation is that I'm going to die before my child. You know what I mean? My expectation is that my parents are going to live long enough so they can see their grandchildren, or whatever, things like that. I thought that was a wonderful way that you put it, as far as violation of expectations, because what I have noticed in a lot of my relationships with people is that is sometimes the spark of a problem, is an expectation. You had an expectation, even sometimes in our marriages, right? I had an expectation, or you had an expectation of me that really wasn't communicated. And so that happens in life in general. A lot of times we're in situations where we have an expectation of a person and they have no clue of it. So that, I think what you just said, I think was powerful as I was thinking about it. It's like, damn, that is a very serious reality that, okay, I have an expectation that my child is going to be around. And when I leave this planet, they'll still be here. But, there's a lot of things that's happening from the perspective of mental health in the Black community that's changing, in the brown community and indigenous communities that are changing as far as mental health, right? Yes. And so we're seeing things change, like suicide rates and gang activity, and so-called people that are coming from good homes, but they're still doing things that are considered not expected of them because of the way that they were raised. Yeah. And so I think, as you have probably heard as well, that a lot of times when we look at young people who get in automobile accidents after they've been driving, or they're high, or we see, young people that are getting into gunfights and things of that nature, some of that is a suicidal activity. Some of those children really don't care whether they die or whether they live. And so those expectations, I think, is really, really powerful, the point that you said. So
we were seeing a lot of young people nowadays, I'm sure you've seen this, planning their own funerals.
Yes.
Because now in our community, it's become somewhat fashionable to go out in a certain way. And so I know I'm living, crazy, and a lot of my homies are going at 20, 22, 23. And I don't like how this one went out, but oh my God, everybody was there, and they did, and so we're trying to outdo the other, even in death. And so because of this expectation that, hey, everybody dies around 20, I want to go out like this. It shows the level of sickness that we are entrenched in. So I'm sorry, I went off on a tangent.
No, that's what it is. It's all good. But I as you're mentioning that, I reflecting on some of the work I do with some of the young men in the communities in Houston, and that's just what it is now in the streets. People look at how other people are killing people and looking at how other people are getting killed, and it's like, if I go out, I want to go out, so that people talk about how I went out or how I took somebody out. And it's crazy because, when we think about the fact that for a young person not to care whether they live or die, that's an expectation that we don't have. You know what I mean? We expect young people to have a desire and a hope to see some years and to be able to achieve some goals and things of that nature. So it's a difficult reality. Yep. Give me a couple shout outs and we're going to get right back to it. Okay. Donna Carter, you say you agree. Please let me know what you agree to. 8 Electronics asks, has Dr. Swift authored any books? So we're going to let her answer that. Just a question. Joshua Stoney, wa alaikum salam, and Laroya Muhammad, thank you for coming in. Wa alaikum salam. So have you authored any books, my sister, or are you planning to?
I want to so bad. I have even started a while ago. One of the books that was growing in me, I've kind of lost interest to some degree, was about marriage. Is another area that I specialize in, and I'm very fascinated about marriage and the dynamics of marriage. But in our marriages, in particular, in the couples that I work with, there was a pattern that I kept seeing, and that pattern was that there was this kind of inequality, I'm going to say, or difference. I don't want to say inequality because it's not necessarily supposed to be equal, but between males and females, and how sisters were often ahead of their male spouses, counterparts. And when I say ahead, in that they were making more money, they were more gainfully employed and steadily employed, they were more the heads of the household, and so often men would come in and talk about feeling emasculated, talk about feeling like, she has control issues, she wants to be in control, and da 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 da. So I would see that, and it was a pattern that I was seeing, and I wanted to really explore that and look at the marriage. And I started doing research and stuff, and I just time. I definitely want to write a book, but I have not had the opportunity of time. But it's not an opportunity that's going to be given to me. It's an opportunity I'm going to have to take. So to be continued on that. Give me an opportunity. I'm putting it out there into the ethers, and hopefully it can manifest it.
All right, brothers. That means you got to give her some thumbs up, give her some high fives, some claps, some loves, and see if we can inspire her to get that going. Okay.
Indeed.
So, sister, next thing I would like for us to kind of delve into is another one of these taboo conversations, right, in the Black community, is this alcoholic or the drug addict or the weed smoker that we kind of just over the years just tend to make excuses, right? A lot of times we look at some of these Black movies that talk about the holidays, or you hear Black people sit around and talk about what the holidays are like. And it's always the uncle or the auntie that's drunk, curses people out, ruins everything, that type of stuff. So we know that's a mental health issue, right? And they are trying to deal with their mental health issue by drinking or being high or whatever the case is that they use to divert the solutions. Mm-hmm. But what would you say are some of the things that we have to look at, and what are some of the potential solutions that we could start to implement in those situations?
Yeah, so that's not my area of expertise, substance abuse. But I mean, I guess I have a few thoughts, particularly because substance abuse and trauma overlap a lot. Right. Because, as you mentioned, many people are using substances to numb from the pain of the reality of their life. And so, in my opinion, when you're working with someone, if you're just working with the person to reduce the substance use, you're missing something there. You really got to go to the core of the pain. I think we see that a lot, with the Nation of Islam, and how we have people from all walks of life that come into the mosque, and many of them have their own trauma, but they didn't go through a therapy. They came to a healing. And because they came to a healing, they were able then to now face the demons of their life and then overcome it. And so I don't, but just, given that as an example, I think it's just really important. It's not about that somebody is using, is why are they using? What is the pain underneath the substance use issue? When we heal that, now we don't have the substance use issue anymore. So that's one thing that I would say to that. But in terms of, how we manage it as a family, I think we have to recognize and hold ourselves responsible as a community of people. Often it is what you described. We just kind of, that's Uncle so-and-so, that's how he is, that's Aunt so-and-so, cousin so-and-so. And we don't like, sit them down. Like, I want to help you. I'm here for you. How can I help you? What can I do? You don't have to live like this. I know they don't like doing what they're doing. So how can I support you? Sometimes you have to let people hit rock bottom before they're ready. And that's fine too. But sometimes we enable people's addictions. And so if you're an enabler, you got to, check that. You have to check yourself. And when I talk about enabling, what I'm talking about for some who may not know is how we permit it to continue to happen. We hide it. Well, so-and-so's not feeling well today. No, they have a hangover. Right. And so you make the excuses and you cover it up for them so you can prop them up and make them look good. We're not doing anything. We're going back to the secret, right? And secrets don't work. So that's another thing that I would say to that, the substance abuse issue, in terms of us as a community of people, that we all have our part. in that.
Yes, powerful, powerful. So next one, I believe this probably would be associated with trauma. And if not, we'll skip it and go to something else. But it came to my mind as you were talking about the power of physical trauma versus verbal trauma, right? And I have heard, of course, both sides of the coin. Hear some people say that physical trauma is worse, and some people say that emotional trauma or verbal trauma is worse. And then I think about the reality that a lot of Black parents spank their children at the same time they're talking, right? So now sometimes we get both of them at the same time, right? So is that kind of some of the things that you deal with, that type of a trauma, and what would you say to the that argument about which one is worse?
I mean, again, I feel like, that's like saying which wasn't your question, but I feel like that's saying like which loss is worse, a parent or a child. I don't think one can say, I broke my leg, my right leg, both bones, and that was excruciatingly painful. But I also went through a very painful divorce.
Yeah.
I can't even, having gone through both of those experiences, I can't even begin to say which way. It was excruciating pain when I broke my leg, but it was also a lot of emotional pain when I went through a divorce. And so I don't think it's fair to say, but I want to say this to that question, that when it comes to a broken leg, right, everybody is empathetic with that. Everybody gets that. Nobody aligns me. There's no stigma. Nobody says, oh, suck it up. You're okay. You can handle it. You need to be strong. Everybody gets that I need help, and they give me the support that I need. When it comes to emotional trauma, it's a bit different. It's not the same. When it comes to emotional trauma, our attitudes and dispositions about emotional trauma are such that it can make it maybe more challenging because often the support is not readily there. And so when people are experiencing depression or going through a painful divorce or, experiencing anxiety, it's like, come on, knuckle up. What's wrong with you? We don't, this is not how we do. I love some of the statements, and I'm reading Rita Walker's book also. I think I'm trying to catch up to y'all. I'm about chapter 4. So I love, she puts in some of those, I don't know if I can call them euphemisms, but statements that we make about, that's so realistic. Like, we don't do this, and Black people are strong, and we like, no. When people go through emotional pain, people need emotional support and help, and it should be just as easy as that. But it just isn't. And I think if there's a difference, I would say the difference kind of lies a lot in how society views each of them, not in respect to which one is worse.
Yeah, that's powerful, because, again, as we read through Dr. Rita Walker's book, it is very plain and obvious to me because, we know a lot of these things are going on in our families, but sometimes life just gets us preoccupied and we don't take the time to really look at it. But reading this book is really showing that as a people, we are still manifesting the same type of reality that we had in slavery. And that is, if I took your child, your wife, your husband, a family member, and sold them to another slave plantation, you didn't have time to grieve. You didn't have time to show emotion. You had to be right back out there doing whatever it was that was your responsibility as a slave. There was no time to grieve, was no time to heal physically nor emotionally. And so we're looking at that in 2021. And as Black people, we're still doing that same type of activity. And so that is, in my estimation, the power of reading this book. And as I said, I think it's it is the most powerful mental health book I have ever read because of the fact that she's concentrating on it from a Black perspective. Yes. And so, again, if you think the show is powerful, please share the show. And if you are looking for something to read, if you're looking for a way to improve your mental health, I think this could be a place to start. You know, having Dr. Swift on the show is for more than one reason. It is because I heard her speak and I know her and I know the power in how she puts things together. But it's also to help you all understand that people that do what we do, so myself being a physician and she being a doctor in the mental health field, we're average everyday people just like the rest of you all. And one of the reasons, like I like to have these type of shows where we can come and we can just be ourselves, is to let you all know that when you need a professional, you need a professional. When we have conversations about improving your health, a lot of times I say, hey, you need to get How to Eat to Live, you need to work on it. But if you get to a place where you don't know how to take it further, that's when you reach out to me. When you have a mental health issue, when you're just trying to make it through life and it becomes difficult, she is a person, and people like her that do what she does, they're not people that are going to be negative. They are people that are going to help give you the type of skills and the type of tools that you need to make it through these times. Depression, anxiety, loss, grief, bereavement, these things are not necessarily easy. Sometimes people are never the same when they go through something like this. Some people are never going to be the same after 2020. Some people are never going to be the same after losing a family member and not being able to go in the hospital and see them. I think I told a story sometime last year where a man and one of his friends, it was another man, I don't remember how they were associated, but he was taking his wife to the hospital because she was having problems breathing. She got to the hospital and she was frantic that she did not want to be admitted because she couldn't have somebody there with her. And so this husband, I don't remember the exactness of the story, but in essence, he talked her into staying at the place and getting over her fear. And she wound up having a massive heart attack and dying.
Oh my God.
Can you imagine the trauma that he is going to deal with? Some of the things that we're doing, if he doesn't actively work towards getting to a place of processing that and healing from that, he may never be the same for the rest of his life.
Yeah.
And so that is the reason that I am having these shows. It's for myself as well. I have mental health that I need to improve. We all have mental health. You can't be Black in America and not have some mental health challenges.
Amen.
Brown and Indigenous in America and not have mental health challenges. But I'm praying that these shows are helping us see that when you need help, there are people that are humble, there are people that are effective, and there are people that are going to help empower you to do the things and do the activity. No difference than if you are having a medical problem or you're overweight. You're not going to get over that medical problem and not going to lose the weight just by talking about it, right? You're going to have to put some things in place. You're going to have to do some things. You're going to have to be dedicated and diligent. You're going to have to make some sacrifices in order to improve. It's no different with mental health. It is the same reality. Pills, I've never seen solve anxiety or depression. I haven't seen medications to help people get over it. It can adjust. I'm not saying it doesn't help sometimes, but I'm saying to solve the problem, it takes work. And so this is just another example of somebody that could be a tool, could be a resource for us as a community to start doing some improvements. Anything you want to say on any of that, sister?
Yeah, no, well, you know, the story that you shared kind of struck me, and it emphasizes how important it is for us, the bystander, to take seriously when a person is saying, I'm in pain, because we can't see that. A physical pain sometimes, not always, but we can see sometimes. We can see that somebody is, you know, is broken or their skin is ripped open or whatever. We can see that. But the emotional pain, you know, this woman is saying, you know, no, I don't want to go, don't leave me. And it might be that she needed to be in there. But it's not so much that I'm saying that she should have been there or should not have been there, but leave her there if she needs to be there, and also address the emotional distress that she was experiencing that ultimately seemed like it created a heart attack. You know, and so like we have to get out of this tendency that we have to just minimize it and close our eyes. You're going to be fine, and close our eyes. We've got to stop doing that.
Yes. Lynn Ali says something I think is highly associated with what you just said. She says, our individual pain is very real to us. I don't believe one person's pain is easier or more painful than another's.
That's
You
right.
know, that's I think what your point is. It's an individual thing, and none of us have the ability to look at another person and say, you know, one of the things that really bothers me in general is when a person says to another person, I understand. You may not understand. Even if you went through the same thing, you can have two people look at the same situation and come up with a completely different reality of what they saw.
Mm-hmm.
So I think that, and then the one that even is worse than that to me is when people use overstand. I overstand. That is
Right. Like, no, you
such an
don't.
arrogant statement. It's such an arrogant pose
Right,
to
right.
a person who may be expressing some pain. And so
Yeah,
when you say I overstand,
yeah.
nobody's going to continue expressing themselves to you.
Right. Thank
I
you for
wouldn't.
that. It's a shutdown. It shuts you. Oh, I understand. So you don't need to say anymore. I get it already. Shut down. And it's very it's negating.
Yeah.
And I think too, it was a point that I just lost it that I wanted to make to that. Um, I'm sorry, I lost my point.
That's okay. I mean, let me say this
Go
other
ahead.
comment, maybe to come back to you.
Maybe it'll come back.
Steve Joseph, first of all, thank you for coming in. Walaikum salam. You said, Dr. Akili, you do a great job to inform on Black mental health subjects. So thank you, brother. I appreciate that comment. So did you think of it already?
I can't remember what you said beforehand. It was something about what you said beforehand. It's not coming.
Okay. So since you mentioned that you are interested and part of your practice is the marriage reality, and that seems like maybe that's going to be part of your book, or is going to be your book.
Mm-hmm.
What kind of suggestions would you make to married people, and whether it's traumatically associated or not? Just in general, with what you have seen, what kind of advice would you give to married couples who are struggling, or if everything is just going maybe okay and it could get better?
Mm-hmm. Yeah. So advice for married couples. I mean, so there's some like your standard stuff. Communication is key, and staying connected. Don't go to bed angry. That type of stuff. I, I'm one that says the good takes care of itself. I always focus on the bad. We all know how to get through the good times.
Yes.
But when things go left, when things are rough, I think there's some key things. Number one, I think, is don't shy away. We have a tendency to pack it away, don't look at it, sweep it under the rug, and then kind of try to move on in the effort of keeping things looking pretty. We focus in marriage a lot on keeping things on the surface tight when things underneath the surface are completely in disarray. And that's not something that you want. Even if the surface has to be a little bumpy, you want the inside to be tight. You want to keep it right. And so I think that the emphasis tends to be the opposite. We want to look good on the outside and we ignore the inside. Another piece about marriage that I think is really important to kind of ground us is the recognizing that in this society, marriage is completely misunderstood as I see it. Marriage is a union that people go into because it's very ego driven. I'm going to say it's because this person makes me feel good. This person loves me because this person has a lot of money, because this person has status, because like all of these things are part and parcel of why we want to be with someone and why we love someone. And therefore, when the person loses their job or loses their money, loses their status, loses, no longer fulfills these ego needs, then it's kind of like, well, why am I with you right now? Right. And so I really feel like we need to kind of check ourselves in terms of understanding what marriage is. What is the institution of marriage about? Marriage, we go into it for the fun, but marriage is more about the struggle than it is the fun. And so if we don't go into it recognizing that piece of it, we'll be disillusioned very quickly. and will be looking for the divorce lawyer because it's like, I didn't come into this for this. I didn't come into it to argue. I didn't come into it to be disappointed. I came into it to have fun, to look good, to da 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 da.
Right.
But that's not what marriage is about. I really feel like, our self-improvement study guide really kind of gives you a lot of the fabric of what marriage needs to be predicated upon in order to be successful. And when the minister talks about our union with one another, paralleling our union with Allah, then it begins to make you realize, this is a deep journey that I'm on. And this journey is not about how good I feel all the time. This journey sometimes is about getting through the tribulation and getting through the trial to the reward that's on the other side of it.
That's right.
And so a lot of times our vision is short and we stop at the tribulation, we stop at the trial. And so we have to recognize, I would want to emphasize in marriage that if you're in it just to feel good, you're probably not going to get to the end. You've got to be in it beyond just the feel good.
That's right.
Because marriage doesn't always feel good.
Yes. Yeah. And for all of you that may be on here that hear us talking about these study guides from Minister Louis Farrakhan, that I want to just make it very clear. That is not just for members of the Nation of Islam. I would suggest that all of you that are not members of the Nation of Islam that hear us talking about it, I would suggest look into it. I'll show the cover maybe on the next couple of shows, but you can find it at storefinalcall.com. If anybody can put that in the comments for me, please, and if I have it right, I think it is storefinalcall.com. But they are powerful. There are what we call self-improvement is the basis for community development, and the minister has pretty much just given us a window view of his life, the mistakes he's made, the things that he's done good, the way he overcomes different situations. So there's a lot of different subject matters, but they are so powerful because you get the opportunity to sit and look and read about what's going on in his life and then reflect on your life and then see if you can implement some of the tools that he used to solve some of his problems, right? Because not only has he been at the forefront of a great organization for Black people, he also has been married for 60 plus years. And so he has a lot that he can give us. And I just want to make sure that everybody knows that the resources that we have as members of the Nation of Islam is not just for us. It is for every and any person that decides that they want to better themselves. And so we'll definitely show pictures of that next week. And if anybody's interested and you don't know exactly how to get them, or maybe even if you would desire to look at it and read a little bit of what's in it, I'll take some pictures if that's what you're interested in, let you read a little bit, and maybe that'll whet your appetite and make you really want to take a look at them a little deeper.
Get that piece about struggle, Brother Akili.
Yes.
Get that piece about struggle.
Oh.
That the minister talks about in the first lecture, self-improvement, basis for community development.
Absolutely. Yes, ma'am.
Yes.
What is it?
Self-improvement, basis for community development.
Yeah, I'm trying to remember that statement. This is my favorite statement is when he talks about self-evaluation,
self-analysis,
self-correction. Right. That's a powerful statement. I'm going to get it right next week and then read it to everybody so they can see how great it is, because to me, it's such a powerful thing that I learned from the minister is that, I can do this and point at people and talk at people all I want to.
All right.
But nobody's really going to listen to that. Matter of fact, you turn most people off when you start talking about what they need and what they need. But if you start talking about what you did and how you improved and what you used to improve your life, you'll get a lot more acceptance and a lot more attention from that perspective. And I pray that I'm growing in that aspect of my life. Anything else you want to say on that, Sister Monique?
No, sir. I think that was pretty all right.
I'm going to do a couple of comments. For some reason, brothers and sisters, I don't know why these comments are doing what they're doing, but anyway, it seemed like there's comments from beginning of the show, and I'm just starting to see them. Roderick Barnes says, in many ways, the secrecy of sexual misbehavior is a cultural thing, so we have to change the culture. Absolutely. And I pray that it starts with these type of conversations. Tracy Breesley, thank you for coming in, my brother. I think you hit the nail on the head. We expect our parents to leave us, but we don't expect our children will leave before we leave. Spot on. Thank you, my brother. Sister Queen, exactly. Meaningful and deep dialogue must occur in our household. Stop the enabling. Yes, ma'am. Catherine Muhammad, I'll be waiting for your book, Dr. Monique, and very excited to read. So there you go. You got that pressure on you now.
Right.
She also wants to know, Dr. Monique, do you do virtual counseling?
Yes, I do. That's all I'm doing right now. I'm not doing anything in person.
Okay. So we will have her give her information at the end, Sister Catherine. Thank you for the question. Angela Marie, have it, reading it now. It's on Audible as well. I think you are talking about the Unapologetic Guide, correct? Let me know. She also says, do you tell that person to reach out rather than asking? Please let me know what you mean by that. I'm not sure what that means. You probably were referring to something that we said. Catherine Muhammad also says, when you experience sexual abuse as a child and you are rejected or not believed by your mother or any other adult, you may have confided in counseling by a professional is a must for healing. Wow, that's powerful.
Mm-hmm.
Yes. What else we have? Catherine again says, I heard the Honorable Minister Louis Farrakhan say that it takes God himself to heal sexual abuse because it kills the essence of you. Wow. A lot of work. Roger Barnes, I think that regarding emotional pain versus physical pain, to your point, we as people have been conditioned through our past experience with slavery and racial discrimination to better deal with the physical pain, much better than the emotional pain. Much less even recognize that emotional pain is severely affected by our mental stability. Powerful point. Yes, sir. Sister Queen, thank you for these weekly eye-opening dialogues. They are much needed. Praise be to Allah, sister. Thank you for that compliment. And Catherine says, yes, those shows help tremendously. Thank you, Dr. Key. Well, thank you all for coming and being a part of it. So, Sister Monique, is there anything that you wanted to discuss today that we did not touch on?
I did want to go back to a point. I can't remember how it was coming up and what you were saying, but it was a thought when we were talking about Rita Walker's book, The Unapologetic Guide. There's a piece in there, and she talks a lot about suicide, and she's talking about some of her rationale for why we're seeing what we're seeing with regard to the suicide numbers. And so one of the things that she points out, two things, and she feels that this uptick in suicides within the Black community, where it used to not be our thing, right? Now we're surpassing white people in terms of suicide rates in a certain segment of our population. Right. And so she looks at two factors, and she says that religion and culture are two factors that kind of fold into this uptick. Because we traditionally have been a people that relied on our spirituality as a way to uplift, as a way to transcend the realities, the traumatic and terroristic realities that we live in every day. And that has been healing, that has been helpful, that has been supportive, but we've gravitated away from that in recent generations. And that is something that what was protective, we're losing. But she also points to culture and talking about how we have taken on, and I think this is a really important piece, we've taken on a very Eurocentric mindset. And what was culturally protective to us then is we're kind of getting away from it. And but there's a piece in there to me that I've been having these conversations that I feel is somewhat missing, and maybe she brings it in a little bit later. And I think I'm getting this more because I'm a member of the nation, and I recognize and see some of what I see is that it's not, I do believe that spirituality is a part of it and that culture is a part of it. But I think there's another element that is really critical as to why we're losing ground with ourselves. And that is that we don't recognize the enemy that is in front of us.
Yes.
We are not. We go into the world. I mean, once upon a time, let me go back. When we knew we lived in a segregated world, we knew what to expect, what not to expect. We
Yeah.
knew who was our open enemy. We knew who was our friend. It was clear. And so even though we went into a hardship or a difficult situation, we went in with our armor on, because we knew what we were going into.
Yes.
Now it's such that we have taken on such a Eurocentric mindset,
Yes.
so much so that we actually believe that the pull your bootstraps up and the world is your oyster applies to us just like it applies to white people. And we go out there and we struggle and we strive and we see other people doing it, but we're like, why are we getting pushed back? Why are we failing? Why are we not advancing the way I'm doing all the right things? Why am I not getting where I need to be or where I want to be? And that's because we're losing sight of a critical piece, and that is we are losing sight of who our enemy is. We're losing sight of the fact that we even have an enemy.
That's right.
And so I think that's one of the pieces that I wanted to kind of lift also. And we can kick that around if you wanted also, because I think that's something that we really need to not lose sight of. It's doing us a disservice to think that we can walk this world in the same way as our white counterparts, given all the forces and pressures that come against us and have that literal knee on the back of our necks.
Yeah, that's powerful, sister. You know, because I've been saying this since last year when the NBA was in the bubble and they had Black Lives Matter on the floor, and you know they get to put this certain things like, you know, vote or, you know, Black Lives Matter on the back of their jerseys, all this kind of stuff. And you see the football players doing it now. They have some teams where they could put Black Lives Matter or whatever on the back of their helmets. And I don't know if some of you have seen, but I saw some pictures today, and I don't remember what city it is, but they have like pictures of Martin Luther King or Harriet Tubman or Mrs. King, Coretta Scott King, on police cars. And so they're doing these things to us as Black people. In my personal viewpoint, I can't speak to what maybe some of you, and maybe some of you can comment if you feel differently, but I think these are appeasements. I don't know if some of you have heard the interview with Kamala Harris, where she said, in paraphrasing, that she's not going to do things just for Black people. So, you know, there's a lot that is going on in this society right now that I think is trying to make Black people think that things have changed. But until the fabric changes, the finances, the housing, the ability for access to things equally to everybody else, then it's all just a facade.
That's right.
And so I think that what you just finished saying is so important. And the reason why I think it's so important to mention on this show is because this is Rita Walker's perspective. And I want to be clear, most people know what we think in the Nation of Islam, right? So whether you agree or disagree is your choice, of course. But we're talking about a sister that is bearing witness to what we say in the Nation of Islam. She's not saying it in the same way that we do, but she is saying very much that we have taken on a mind that is detrimental to our psychological fortitude. And so your psychological fortitude is your mental strength to be able to deal with everyday life. And so if you want to send your children to the better schools and you send them with all them white folks and they go through hell and they're never the same, was that a good balance? Was that a good sacrifice?
You got to consider that.
We really have to start thinking about that as Black people as we continue to go down this reality of being in 2021. And we can literally say, I think my vantage point is that things are not better than the way my parents told me the way they grew up. Things are not better than the way my grandparents talked about things were when they grew up. We're watching these things happen because we have these phones. But the reality is that from an economic, from a ownership, from a being in control perspective, Black people are not in a better shape. Statistically, we're not in better shape. So we really have to start discussing things. And that's why I think this is such a powerful book, because it poses mental health from a Black perspective, not the Nation of Islam, but a Black perspective. And I think she does a wonderful job. Doesn't mean that you're going to agree with everything that she says, but I think it will be enlightening because I have never read a book before that came from the Black perspective on how we improve our mental health.
That's right. You said so much. But like, yes, thank you for stressing that, because I feel like truth is truth. And so it's going to ring true no matter where you're getting it from. But you said so much. And the pictures, I haven't seen that, but the pictures on the police cars and stuff, we get so head over heels in what I call symbol over substance.
That's right.
There's zero substance. I don't care if you have a picture of Martin Luther King on your police car, right? Your knee is on my neck.
Come on now.
Killing my brothers and sisters, but you got a picture of Martin Luther King. That's almost offensive, right? And so, but so many of us get so, we're head over heels. We get so happy when we see these and we think this is the progress that we're fighting for. That's not the progress that we're fighting for. That's what we're getting duped into being satisfied with. And I'm thinking about I didn't see the interview where Kamala said what she said, but it brought back to me Obama and where he was also when he was in the seat. And I remember, I didn't hear him saying this, but someone saying it of him, that he says, a rising tide lifts all boats. When he was presented with the question about what are you going to do for Black people, his rising tides would lift all boats. Yeah, and so he never had an agenda for Black people. Kamala's going in there without an agenda for Black people. These are the people, we are at the bottom. We're championing these people, saying, yay, Obama, Black president, yay, Black female vice president, and they have no thought, no agenda, no interest, no concern for the people that they came from. We have to really begin to stop and think about this and stop looking at there's a saying that we have, skin folk ain't all kin folk.
That's right.
And so, this is a Black face, but we have to stop being suckered into the symbol and begin to look at, is there substance here? And if there's no substance, then I'm not satisfied with that.
That's right.
Yeah.
Be held accountable. Exactly. And on that note, I think it's very, very, I shouldn't say very similar. It is the same as what I said about these physicians that are on social media and the physicians that are, prominent and making these public statements. And then now the celebrities like Plies and Tyler Perry that are promoting the vaccine. You haven't done the research to be out here posing information to a public and trying to have influence over people because you haven't done your diligence.
You're responsible.
So you are going to be held responsible. I don't mean that in a mean way. I'm not trying to demean people, but if these vaccines start producing the type of things that some people are worried about and some people are predicting, then what are you going to say as a person that pushed that, right? And what are we going to do as Black people?
That's right.
So enthralled over the fact that Michelle Obama looked beautiful and Kamala Harris, and she got her beads and her Converse on. I'm not against Black people celebrating when we see things happening with us. I'm not against that. But I do think that we have to do a better job of putting things in a realistic perspective, because looking at Michelle Obama and President Obama and Kamala Harris up there with all the stuff that was going on. Okay, if that's something that you want to celebrate, good. But after all of that is over, it's time to get back to the business of what is being done for us. And if nothing is being done for us, then what are we going to do for ourselves? As I always say, I know that no person on this call tonight can go to Chinatown and get a job, nor Koreatown, nor Japantown, in any of the cities that I've lived in. So why are we so accepting for there to be Asians and Arabs and all these different people in our communities? It's time for us to start supporting each other. And it starts with freeing our minds first. We have to understand first before we can do anything physically. And so I hope nobody is being offended by what we are saying, but I hope you are looking at it as the fabric of thought and a thinking process that raises our mental health, because that's one of the things that she mentions in this book. It's about the things that are going on with you as a Black person. If you as a Black person see a white president, that doesn't do anything for your psychological fortitude, but seeing Obama in that office did.
Yes.
It changed the reality for my son, because I know as a little boy, I remember conversations between me and my friend, oh man, you can't be president. But my son doesn't say that.
Hmm.
Getting ready to graduate from high school, my son doesn't see that there are any limits to what he can do. And I love that.
Yeah.
Now, I will give him the reality if he decides to go into politics or some of these other things. You're going to see the reality of racism. And that hasn't changed. But the fact that the cap has been taken, the box has been removed around his reality to think that he can achieve anything in his life, I think is powerful. And that was the only reason that I went with the whole thing. I went to the inauguration and all that, was to remove any limitation off of my children's mind. So for that aspect, it's a benefit. And that right there is what the minister taught us, right? I wasn't looking at it from that perspective, but the minister taught me that. Find where you can find something good in this reality, because we never, as members of the Nation of Islam, had any thought in our mind that he was going to do something for Black people. We don't have any idea, no thoughts that Kamala Harris is going to do anything for Black people. But if we can find a silver lining in that, it's always good to find that in there.
Yes.
Right, my sister?
Yes, yes. So,
all right, a couple of statements and I'm going to give it back to you, okay? So we got Joshua Stoney. He says, I just want to say I love your show. Man, that's a beautiful compliment. I thank you for coming on and being on the show, and I thank you for that compliment. Lynn Ollie says, I agree, and we bite the bait, not realizing the trick to pacify us. Yes. She also says, Dr. Walker said we have to be more sophisticated in our understanding of racism and what truly is and looks like. She titled her chapter as Racism is Bad for Us. That's right. It's bad for our psychological health. Absolutely.
I'm almost there.
Let's see if we have any Facebook comments. I don't see any. So
you have a great audience.
Yeah, I consider myself having the greatest audience on the world.
You really do. They're very engaged and engaging.
Yes, and that's what I love. I love the way they add to the conversation. So I think we get a lot of agreement in that. All this stuff that's going on is just pacification. Store Root Toussaint Fulton says rising tide lifts all boats also comes from the NAACP. Okay, yeah, so he was mentioning that in Obama's statement at that. I think it was like a town hall meeting where a Black man stood up and asked that question. Yeah.
Okay.
Priscilla B. Timmons says that's a trap in mind control. That's right. Angela Marie, the psychology of Black people. That's right. Okay, so another question for you. Question: how does Dr. Swift view the book Black Men's Guide to Understanding the Black Woman as it relates to the breakdown of the Black family?
As it relates to the breakdown of the Black family, oh my God. To be quite honest, I read that so long ago. It was a very popular book when it first came out. Of course, I got it. And to be honest, there was a lot of controversy around it, but I was with the sister. I remember talking about giving her an open hand and smacking her mouth. I wasn't with that, but that's one of the things I remember. Give her an open hand and smack in the mouth. If she gets out of line, she would say. We don't want to do that. We don't promote that at all. However, I would love to answer that question, but I cannot recall. I remember there was a lot in that book that I agreed with. I think that ruffled the feathers of people, but was fundamentally like truth that we really need to listen to. And I wish I could be a lot more descriptive and specific in what I'm saying. I just remember I had a generally good feeling about the book with some points of discrepancy. That's what I can recall.
Well, I'm gonna tell you this. I've already seen a couple of comments say that you have to come back, so you got to have some time to go look at that and come on. I
gotta go read the book again.
Priscilla B. Timmons says these shows are really helping me both mentally and emotionally. I was seeing a therapist and I couldn't really connect with her, but since I have been reading the book about mental health and watching your show, I am able to connect and have begun healing and dealing with things and people differently. Wow. I don't know if I have had a comment that's beautiful, Sister Simmons. That is amazing, because in all honesty, that's my motivation, right? My motivation is not money. My motivation is not number of likes. My motivation is not how many people follow me. My motivation is trying to make a difference in people's lives. And so that is a beautiful compliment. I thank you. Sister Angela Marie says, when you coming back, Dr. Swift?
Oh, when Brother Achille lets me return.
Well, I guess that means that we're gonna have to extend this. And I definitely know. Real quick, Christine Crowder said this is helping me on so many levels. So there's another one. Yes. Z Kazim says, Honorable Minister Louis Farrakhan asks, do you really know who the enemy is? There you go. So yeah, I think again, this is another powerful show. And the way that you all are responding, I'm pleased that it is helping, because that is the purpose of it. And so we will definitely continue. Like I said, the rest of the month is booked, but we'll definitely have Dr. Swift come back in March if her schedule permits, and we will put together something to make sure we have something good to present, and then of course answer you all's questions and interact with you all, because what it is that you all need is what I would like to continue to do, and that is the type of shows that are helping us improve ourselves. I think the next 3 shows are going to do that as well, and we'll continue to bring back the people that you all asked to bring back, because that's what we're trying to do here, is help you and support you and what it is that you need. So Sister Dr. Monique Swift, would you like to say anything to close us out?
I mean, I want to thank you, my good brother, for doing what you are doing. And I hear the comments from the audience. You know, a good word goes a long way. You started off this segment asking about the power of words. And, you know, when a word resonates within us, and we know when a word is true, and truth can feed us, and it's clear, it's evident that what you're doing is feeding the people and creating a vibration of healing. And that is so important. And I want to thank you, first of all, for allowing me to be a part of this, but mainly for doing what you're doing and helping the people that you're helping, and raising this conversation about mental health in the way that you are. Thank you. Thank you, sir. I've known my brother for some years now, but I am just becoming acquainted with this show, and I'm going to have to make sure that I'm tuning in. So I definitely look forward to learning and participating along with other future guests that you have. So keep doing what you're doing. May Allah bless you mightily.
Well, thank you, sister. I appreciate it. That's a wonderful compliment. And I really would like for you to check out the next couple of shows. I mean, I know you're busy, so I don't necessarily know if you'll be able to be there live. But if you have the ability to be there live, I would like to see some of your comments. Because like I said, for everybody that's on and is kind of anxious on what we got next week, I have a special guest, and we're going to be talking about healing from loss of a child. The week after that, we're going to be dealing with mental health and how it is associated with your physical health. So balancing those two things, mental and physical health, together. And then the last week, the last Tuesday of this month, is going to be a very personal show. And so I'm not going to give any other information other than that, but I believe that it's going to be tough. So I pray that I'll make it through it well, but I also think it's going to be probably a very powerful show that's going to help us start to, well, let me just say this. When it comes to hard conversations, it's easy for us to say we need to do it as a Black community. But if we put our own vulnerability out in front of everybody, then I think that is part of what we have to do as showing the way. And so I pray that show at the last Tuesday of this month will be that, a show that helps people realize that we all can open up and be courageous and brave enough to say, you know what, I'm going to have to do something to heal from this. I'm going to have to do something different to heal from where it is that I am, from what it is that I have experienced. And that is the only way that I've seen anybody heal any problem, whether it be physical or mental, and that is to do something different. If you had the capability to do and accomplish everything on your own, then you wouldn't need anybody. But we all are in need, because that's the way God made us. He made us community oriented, so that we could interact with each other, and the strength from you builds me sometimes, and my strength builds you sometimes. And so I pray that that's what we're building here in the Ultimate Wellness Group. Transformation Tuesday is a family that is interested in that great compliment that Monique gave, in that we are trying to produce something here that's going to grow and swell into a new healthcare paradigm, right? Because what we have right now isn't showing the promise that I think it should. And so that means that we have to be part of being bold and brave enough to produce something new. So again, thank you, Dr. Monique Swift. I appreciate you coming on the show. I appreciate you taking some time. Appreciate the great compliment. Thank you all for coming and joining the show. And as you wished, she will be coming back. Yeah. And we'll have to figure out that time. Of course, both of our schedules are crazy, very busy. But you know where I'm going to be every Tuesday, trying to give you some news that you can use, trying to help us and empower us to take control of our health, stay in control of our health mentally and physically, so that we can be who it is that God plans for us to be. So thank you all. In the world that we live in, you know your health is very important, and it takes a lot of work to have good health. So continue working hard on your health. And thank you again for your being here. Thank you for interacting. Thank you for sharing the show. If you shared the show, thank you for telling somebody about it. And please come back the next 3 weeks. And as long as this show is around, please keep coming back. So thank you again. I pray that you have a wonderful rest of your evening. Yes, ma'am?
I'm sorry. Can I just leave my email?
Absolutely. Put your email and all of your contact information in there.
My first and last name, Monique Swift 19 at yahoo.com. I am only licensed to work with people in New York and New Jersey, but I'm a part of a network of psychologists all over the nation. So if there's some way that I can help to connect you, I'm happy to do that. Monique Swift 19 at yahoo.com.
Okay, y'all got that? Monique Swift. No, your email is Monique Swift or M Swift?
Monique Swift, full name. Well, this is my business email, Monique Swift 19 at yahoo.com.
So Monique Swift, you see her name down there. So Monique Swift 19 at gmail.com, correct?
At Yahoo.
At Yahoo, I'm sorry.
Okay.
Monique Swift 19 at yahoo.com. Is there a number that they need or any other social media sites that you would like to give?
My phone number is 646-600-8118. Again, 646-600-8118. No social media.
Okay, so those of you in the New York or New Jersey area, that means that she could definitely help you if you're in that area, or if you know somebody in that area that may need her help. And otherwise, she may be able to have some resources to help you in the area that you're in if you're not in those areas. So thank you for that. I'm sorry I forgot to give that. So that's it for the show, y'all. You have a wonderful rest of your day and a wonderful rest of your week. And until next time, peace.
Peace, family. You want me to just sign off?
Give me just a second. I'm going to end this.